Hello, everybody, and welcome to another episode of the Smart Human Podcast. Today, I am honored to be joined by Dr. Andrew Weil, physician, author of over 14 books, educator, and one of the world's most influential voices in integrative medicine. Today, we're talking about the innate ability of the body to heal, food as medicine, mental health, ancient healing practices, the tenets of integrative medicine, the rise of infectious disease, AI and the future of medicine, and so much more. So stay tuned. Hello, everybody, and welcome to another episode of the Smart Human Podcast. Today, I'm honored to be joined by Dr. Andrew Weil, physician, author of 14 books, educator, and one of the world's most influential voices in integrative medicine. For over 6 decades, Dr. Weil has helped bridge ancient healing traditions with modern science, reshaping how generations of clinicians and patients think about food, lifestyle, and the body's innate capacity to heal. His work has trained thousands of physicians and helped bring integrative medicine into the mainstream. Dr. Weil, thank you so much for being here. It's truly a privilege to speak with you.
Well, it's wonderful to be with you, Ailey, and I'm looking forward to our conversation.
Me too. So I want to get right into it. For the audience that I speak to, I wanted them to learn a little bit about your origins. Before medicine, before books, what sparked your curiosity about healing and the body's capacity to heal itself?
I think my interests go back as far as I can remember. As a kid, I was fascinated by the mind and consciousness, and I wanted to know how the mind affected the body. I have a lifelong interest in plants, something I got from my mother, which she got from her mother, that led me to be a botany major at Harvard as an undergraduate, which is a very fortunate choice. I had an aunt, my mother's older sister, who was the kook of the family. She was a vegetarian. She went to chiropractors, and that first sparked my interest in other ways of doing medicine. And when I was an undergraduate, I began reading about alternative medicine. So these interests go very long-standing.
Yeah, no, I know you've had lots of variety. I mean, it reflects in the titles of the books that you've written. You've written books about, The Natural Mind was your first book in 1972. And then you also wrote a book about, From Chocolate to Morphine, and also talk a lot about the consciousness and subconsciousness and even psychedelics. So, that was early on.
Yeah, let me interrupt you for a moment.
Yeah.
Between 1971 and 1975, I had a wonderful fellowship that allowed me to travel throughout the world looking at altered states of consciousness, drugs, plants, healing plants, other traditions in medicine. I spent a lot of time in South America, some in Africa, but that gave me a much wider perspective and really made me aware of other cultures' ways of interpreting reality, including how they looked at healing and medicine.
Yeah, that's wonderful. And that was actually, I think, right after college. So you were a young person at that point, and and then what brought you to Arizona, and the story behind how you actually began teaching and training in integrative medicine? I mean, that was a big jump there.
I grew up in Philadelphia. I never imagined that I would live in Tucson, Arizona. My car broke down here in 1973. That was after I was finishing these travels, and it took 6 weeks to get fixed. It was February of a warm, wet winter. The desert was in full bloom. I met people I liked, and I never left. And it turned out that was a stroke of good fortune, because I don't think I could have done what I've done on either coast or at other universities. The University of Arizona was, very conducive to some new ways of thinking.
And you helped define integrative medicine for the world, really, back then. And in your own words today, how would you describe integrative medicine, and how is that evolved?
One way I describe it is just good medicine. I've always said one day we'll be able to drop the word integrative. I think one way of defining it is it's the intelligent combination of the best ideas and practices of conventional medicine with those of other systems of healing, traditional systems of healing, with natural remedies, and with an emphasis on prevention and health promotion. I've also say to people that integrative medicine attempts to correct the greatest excesses and deficiencies of conventional medicine. I think the greatest excess of conventional medicine is the misuse and overuse of medication. And I think the greatest deficiency is its neglect of the non-physical, that it only looks at us as physical bodies, and all treatments are directed toward that. And I think that greatly limits our effectiveness.
Yeah, I mean, there's such a desire to learn other tools outside the conventional Western toolbox. I mean, I know that drove me to get involved with your fellowship, which was the first fellowship in integrative medicine training, I think back in 2000, was it?
Yep.
Since that time, you've trained countless numbers of mostly physicians, but certainly some other healers from Allied Health. In staying the course, I mean, you basically came at a time in the 60s and 70s when this was not really welcomed into the conventional Western establishment of medicine. To say the least, tell me a little bit about what you had to encounter that most of us take for granted, actually.
There was a growing consumer movement that built through the 1970s, 1980s, people wanting this kind of medicine, but the institutions were very close to it. And I was paid really no attention by my medical colleagues, and if I did get any attention, it was very negative. And that didn't change until the early 1990s. And I think what happened then, that was when the economics of healthcare really began to deteriorate. And the conclusion that I draw is that no amount of ideological argument moves anything. It's only when the pocketbooks of institutions get squeezed that they open to new ways of thinking. So my best friend from Harvard Medical School, Joe Alpert, cardiologist, came to be chief of medicine at the University of Arizona. This was in, I think it was around 1991, and he came with a new dean, both from the University of Massachusetts Medical School. And, this was a chance to make change. And I went to the dean and said I wanted to start a fellowship in this field that I was calling integrative medicine. And he gave me a blessing to think about designing a fellowship, and that was the origin. We now have, as you know, a wonderful physical center, and it is the first dedicated academic integrative medicine center to open in the heart of a medical campus of a major university. And it's embraced by all the units of the Arizona Health Sciences Center and by many of the colleges on the main campus as well. So it really represents a milestone.
Yeah, I mean, and to think that as a pioneer to start that program, there's been successive, programs to train other physicians, allied healthcare workers. There's many offshoots. And I think so it shows you the ripple effect of what you created at that time, which was sort of an uphill battle. You've long championed food as medicine.
Yes.
I know we talked about medication, by the way. I want to make a quick comment that is one of the key things that I think about quite a bit as a rheumatologist who deals with so many medications at this point. But you've made comments, use the least amount over the shortest period of time. Do you want to elaborate on that piece? Because I think it's so important.
Integrated medicine certainly doesn't reject medication, but I feel that when we use it, we should, as you said, start with the lowest dose of the least potent agent as demanded by the circumstances of illness, and then work up from there. And also, I think medication should only be used in the context of an integrative treatment plan that begins with lifestyle modification, including dietary change. But it should not be the sole or primary treatment. And I think most people have no idea of the harm caused by the medications that we give out so freely. First, in terms of adverse reactions, many of them fatal. The numbers of people, it's just staggering. And the other is that I think long-term reliance on these suppressive, counteractive medications can actually get you into worse trouble, that they can intensify or prolong diseases. They're okay for short-term management, but then you want to find other methods to maintain improvement.
And in fact, integrative medicine teaches a lot of, not to simplify, but the hacks of Western medicine in many ways. If conventional people, it's a way of having alternative options for some of the same common ailments that we experience, whether it's reflux, whether it's, hypertension, whether or not it's managing sugars. But the idea that that you've championed food as medicine is just so critical because it's talking about how food in and of itself has the ability to heal.
Yeah, not a new idea. Hippocrates, the 5th century BC said, "Let food be thy medicine, and medicine be thy food." In my 4 years at Harvard Medical School, the total instruction I got in nutrition was 30 minutes, which were grudgingly allowed through a dietitian at one hospital I worked at to tell us about special diets we could order for patients. That hasn't changed substantially since I've been out of medical school, although it is now beginning to change. And there have been calls even from leading medical institutions for curriculum in nutrition to be developed and included. But I think still most doctors are ignorant about the effects of dietary change, and it's not their fault. They weren't taught it, and there was not even any place you could go to learn that for medical credit. And as you know, the food served in medical institutions is generally awful. The last I checked, I think something like 48% of American hospitals have fast food restaurants on their premises.
Right.
So, we have a long way to go. When I write an integrative treatment plan, almost always the first step is about dietary change. And often I've seen that alone produce remarkable improvements over time, and certainly in rheumatological conditions.
Yeah. And do you feel the same way about drinking water now that that's sort of come more into focus in terms of what our pollution level is in this country?
Yeah. And the whole issue of environmental causation of illness, another subject that was neglected in my medical education, I think is getting a lot more attention now. And, but what we do about that it's not so easy to protect yourself from all this stuff. And even looking at water, I think it's a very good idea to get your water tested to find out what's in it, and to think about, purifying it. There have been increasing numbers of articles about dangers of bottled water, in terms of pollutants that it can contain, of leaching plastics into the water and so forth. So I don't know that that's the best solution.
Yeah, it's a big topic, but now with reverse osmosis and some of the newer technologies being more affordable, it's really kind of brought the ability to manage at least that one particular issue a little bit better. Yeah. Question for you. You wrote a book called Healthy Aging, one of your many books and publications that you've been involved with, in 2005. 20 years ago, before we had longevity medicine and anti-aging medicine, before those became a thing, right, in the health and wellness world. What are your thoughts on that, and how do you feel that you've handled your aging process over these last 20 years?
Okay, first of all, I really am bothered by the whole concept of anti-aging. What I started out in that book to say was that aging is a natural process. Everything in the universe ages. Plants age, animals age, mountains age, stars age. If you make your goal anti-aging, you're putting yourself in a very wrong relationship with nature, and that's not a good place to be. Mm-hmm. And also, I think if you're obsessed with anti-aging and longevity, that can distract you from what I think is most important, which is learning what you can do to ensure that you age in a healthy way, that you maintain health as long as possible, and compress the time of disability and decline at the end of life into as short a period as possible. So I'm now 83. I can't believe how I got here. I think I'm doing pretty well. And, I live by my own advice. So, aging is really interesting. And also in that book, I wrote about, we have such negative ideas about aging. And I asked people to think about what in our experience gets better as you age, and I used examples like old violins and trees and wine and whiskey. But, there are aspects of aging that I think are really interesting. Many older people that I've talked to say that they have greater equilibrium, emotional equilibrium now than they did when they were younger, that things don't throw them off balance as easily. Although many people think memory declines with age, there are actually some aspects of memory that I think improve. One scientist I talked to said that, when something new comes along, it's easier for him now to place it in the right context because he has more in his filing system to compare it to. And not everything deteriorates with age.
That is for sure. And I like to believe that as am aging myself. And in fact, you actually are at the same age. You went to school with my dad back, but you
Yep.
didn't know him, but you went to the
Yes.
same high school. So there's kind of a fun
Right.
connection there. And I feel very connected to you and your work. But yeah, aging is a phenomenon. And, there is such a battle to kind of control it, to constrain it, to mask it. And I find that must be very unique for you to observe over these
Yeah, not only
decades.
that, Ellie, I think that in our culture particularly, we don't want to see old people. We want
Right.
to put them out of the way. And all marketing efforts are directed at a young demographic. I spent time in Okinawa, which was famous for long-lived people. They had a very high concentration of centenarians. And one thing that struck me there is that the very old people were included in all cultural activities and were considered, living treasures, and they felt valued and included. Very different from what I see here.
Yeah, and we don't live with our parents and our grandparents and have those set of hands on site. It's
Yep.
often, visiting and that kind of thing. And that's kind of changed even the dynamic of the family in some
Yep.
respects. So interesting how that's changed. We've also tried to live longer with technology, be it, dialysis, my dad was involved with, but things that, medications and living longer but not necessarily living healthier.
Yep.
Do you see that what is your thoughts on the distinction of that?
Well, I think, as I said, that what the goal should be healthy aging, to maintain health as long as possible,
Right.
Rather than the number of years that you live.
How do you think new technology coming through now, AI, we're seeing this with mammography. They're running my breast, mammography results through AI, which is making it better in many ways. What are your thoughts on AI and
I
how
think
that will
AI
change?
is going to change
Yeah.
everything. And I think we're just beginning to see how it's going to change. I think some things, I don't know, I worry about some aspects of it, but I think in general, in medicine, it might be a great boon to us. It might make diagnosis much easier. It might make some treatments much better. So I think on the whole, it's going to improve medical care. And I'm not anti-technology. I think, that properly used technology can have great benefits. And I look forward to seeing what we come up with.
In terms of mental health and the mental health kind of epidemic we're having,
Yeah.
what are your thoughts on that and how that's evolved over
You
the
know, I
years
think
as well?
to me, psychiatry is really in a sad state because it is completely dominated by the materialistic paradigm, which says that all emotional disturbance is a result of disturbed brain biochemistry, and therefore the only intervention is by giving medication. And the fact is that, except in certain instances like treatments for bipolar disorder, I think the psychiatric drugs are not very good. They're not very effective. I think they have very significant adverse effects. And there are many other methods available for managing common conditions. For anxiety, the commonly used medications, the benzodiazepines, are just terrible drugs. Highly addictive, interfere with cognitive function, and don't work very well. Whereas the breathing techniques that I recommend, like the 4-7-8 breath, are incredibly effective and free and take very little time. For depression, there are so many things you can do: increasing physical activity, using cognitive therapy, practicing gratitude. It just goes on and on and on. And the antidepressant drugs are not very good.
Yeah, and there's been a lot of controversy over that. If you start them, some of these antidepressant medications, and if they're not giving you some type of benefit within a month or so, then likely they're not necessarily going to work, at least that particular choice.
And not only that, if you continue them, they're likely to prolong or intensify depression. That is, what I referred to earlier. If you give a drug that increases serotonin at neural junctions, over time, the body is going to try to counteract that. That's the homeostatic reaction. So it will drop serotonin levels and drop serotonin receptors. And then if you stop the drug, say after 6 months, a year, often depression is worse than it was to begin with and prolonged.
And, you speak of serotonin, which 85% is in the gut. What are your thoughts about what we're seeing now with all these, not only gut methods of helping the gut work better with the microbiome, which has advanced over the decades, but also now these medications? What are your thoughts on that?
I think the gut-brain connection is very firmly established. And the fact that neurotransmitters are produced in the gut, I mean, that's fascinating. And also all the research on the vagus nerve and this as a major connection. I think this is a real frontier area of research that's going to open up new treatments. By the way, I've never been that much convinced by the serotonin hypothesis of depression. I think the inflammatory hypothesis of depression, to me, is more compelling. That depression is one consequence of upregulated inflammation.
And by getting to the root cause of where that inflammation stems from is how you get to maybe some, if not all, of the root of mental health
True,
issues.
and that again comes back to diet. As you know, I have an anti-inflammatory diet that I recommend. I think the mainstream, the standard American diet, which is abbreviated SAD, is strongly pro-inflammatory. It gives us the wrong kinds of fats, the wrong kinds of carbohydrates, and not enough of the protective elements that are mostly found in fruits and vegetables and herbs and spices.
And mushrooms, big part of your history and your love. Yeah, you love your mushrooms. Tell us a little bit how mushrooms play a role in mental health, but also in lots of different other areas of health.
Well, I became interested in medicinal mushrooms long ago. Originally I was first interested in magic mushrooms and then in edible mushrooms. But as I began reading about traditional Chinese medicine, I was struck by the fact that mushrooms are very prominent in it. And many of these medicinal mushrooms have effects that we don't have medications for in the West. And some of them are specifically useful for mental and brain function. I suppose the main one is lion's mane mushroom that many people know. It's a delicious mushroom and now is available as a food mushroom in many places, in many stores, but you can buy also extracts of it. I think this increases nerve regeneration and stimulates nerve growth. And looks as if it may protect cognitive function, so very useful and completely non-toxic.
And when they commercialize mushrooms into powders and shakes and all these things, do you think that in some way diminishes the potency, or is there changes?
Not necessarily. In traditional Chinese medicine, these medicinal mushrooms, well, some of them are eaten because they're good food mushrooms like shiitake and lion's mane, but others are too woody or bitter to eat, and they're commonly made as hot water extracts, and that's been used in Chinese medicine for a long time. So I think you can preserve the effects of these mushrooms if they're handled in the right way.
Okay. And tell me a little bit about psychedelics and how far we've come since we're talking a little bit about mental health and mushrooms.
Well, I think this is a very interesting time. It's taken years for there to be reopening of interest in psychedelics as therapeutic agents. I think that was established back starting in the 1950s. We began to see their potential usefulness, and they're so safe on a physical level. I think they're among the safest of all substances. And the main dangers are psychological, and that's related to set and setting, to expectation and environment. So there has been, I think now, enough research to document the benefits of psychedelic therapy in mental emotional conditions, especially depression, anxiety, PTSD, OCD, and so forth. But I'd love to see them used in physical medicine as well. I've seen some very dramatic remissions or cures, including of rheumatological conditions with psychedelics. I have a friend, former patient, who had pretty severe rheumatoid arthritis, a lot of surgeries for it, which disappeared after an MDMA experience. And he was able to maintain that by taking MDMA occasionally. So that should be explored. These are not just useful for mental emotional conditions. Tremendous.
Yeah, I was going to say, I agree with you. And I was wondering if you think the FDA and regulation should play a role.
Well, the first step is, we've got to get them out of Schedule I under federal law. things go into Schedule 1, they never get out. And, Schedule 1 is defined as high abuse potential and no therapeutic potential. I mean, that's absurd. But that will take, an act of Congress to change that, and that's not happening yet. However, the momentum for this is tremendous. I don't travel as much now as I used to, but I think probably before COVID, I was going around a lot giving lectures, and it didn't matter what I was talking about, whether it was nutrition, healthy aging, integrative medicine. I would get questions on psychedelics. How can we find them? How can we find people trained to use them? The interest in the general public in this subject is enormous and building. And, a number of states, New Mexico being the most recent one, has just authorized the use of psilocybin for a number of defined mental conditions, including end-of-life care, which I think is tremendous.
And speaking of regulations, I'm going to ask you something a little controversial, but what do you think in terms of what we're seeing now with the rise in measles and, commentary on vaccines? Just wanted to know your thoughts where we are at this time.
It's a polarizing subject that I hesitate to even talk about it in public. And when I was in medical school, when I was growing up, the people who didn't vaccinate were uneducated people, poor people. Today, it's highly educated people who are rejecting vaccination. And I think that's just completely misguided. Vaccines are not without risk, but I think the risks of the diseases that they prevent are much, much greater than the risks of the vaccines. And if people lived with diseases like diphtheria and tetanus and polio, nobody would be questioning this. And, we're seeing, it is certain that these diseases will come back as people stop vaccinating. We're already seeing that with pertussis, with whooping cough, and with measles now very dramatically, which we pretty much eradicated, and now it's coming back. So I find it very disturbing, especially two things bother me particularly. One is that I hear some doctors now getting on this anti-vax campaign. I can't imagine that. And the other is there's an anti-vax movement among pet owners. That there are people not vaccinating dogs for conditions like parvo and distemper and most alarmingly rabies, a really, really terrible disease. And that bothers me very much.
Yeah, and it's going to potentially affect the thoughts and the training of future healthcare workers and future doctors, which kind of brings me to my next question for you. You've created your integrative medicine training program. You've had such a ripple effect. What's the most important quality you hope physicians will carry into their practice?
So many of the people who've come to us for training have said they were on the verge of dropping out of medicine. Because they had become so disillusioned with the nature of healthcare today. And they said that coming into this training program restored their faith in medicine, and they were able to join a community of like-minded people. So that's what I want to see that happen on a much wider scale. And also, if I get on my political soapbox, as dysfunctional as our healthcare system is, it's generating rivers of money that are flowing into very few pockets. It's the pockets of the big pharmaceutical companies, the manufacturers of medical devices, the for-profit healthcare systems, the big insurers. Those vested interests have total control of our elected officials. You can't get elected to office in this country unless you've made deals with that. And it's one big tangled mess that also involves medical journals, and what research they publish. It's taken autonomy away from doctors. You're now told what treatments you can prescribe and what you can't. And the only way that's going to change is if there is a grassroots social political movement in which enough people get angry enough about the situation that we begin electing different kinds of representatives. I don't see that happening yet. And every time we have a graduating class at our center, I tell them, my hope is that you will be, the catalyst of this social political movement. And you can help, people, your colleagues and patients see, how dysfunctional and counterproductive this is. And the whole system has to change. So that would be my greatest hope, is that, what I've started will become a movement that will transform the nature of healthcare. I think the great promise of integrative medicine, and why it is now, becoming mainstream, is that it can lower healthcare costs and improve outcomes. And it can do that in two ways. One is by shifting the whole focus to health promotion and disease prevention, which now don't pay. And also by bringing into the mainstream treatments that aren't dependent on expensive technology.
Yeah, well said. So let's hope that things move in a different way. It's very daunting. I know there's a big burnout, as you said, burnout rate. And, there's a lot of, I want to say distrust, but, the question is, where's that distrust being focused
it's not
on?
focused. Yeah, it needs to focus. I think time is on our side, Ellie, because the economics of healthcare are only going to get worse and worse, and the outcomes are not getting better. We have this epidemic of lifestyle-related diseases that we are not managing well. And I said that, in my early career in the 1970s, 1980s, this was a consumer-led movement. But now I think it's driven economically, and that's only going to get worse. And the worse it does, the more people will see the wisdom of what we're doing.
Yeah. Yeah. I mean, integrative medicine just always made sense to me. And, in a very logical way that employs as many, brings in as many tools, including ancient healing. And now there's a big push even by the World Health Organization. There's a meeting even this week on bringing in traditional medicines from around the world and different cultures. So I'm hoping to share that on this podcast as well. Stuff that I don't know very well. I'm trying to learn as well. So we're coming to an end of our conversation. I know you're a busy person. What questions about health and healing still fascinate you, actually?
One of the first philosophical principle of integrative medicine is that it focuses on the innate healing capacities of the organism. I think most people I meet do not have great confidence in their body's own healing abilities. And I think that's one of the things I've always tried to convey in my writings and teachings. And I would love to see that really begin to be researched. What is the body's healing system? What are the mechanisms? I think the whole first year of medical school should be devoted to that, to the healing system of the human organism.
Yeah, it's great. I think anthropology and evolution should be really emphasized. How did we get here? Why? How did we get here? And what are we playing with here? This has been a lovely, lovely conversation, and I appreciate you taking time. You're at a point in your life where you get to enjoy things like grandfatherhood, and you have I know you love your dogs. That's one thing I feel very connected to you with, as being an animal lover and a dog lover. Are you still working on projects now, or what do you have your hands in, and what do you feel excited about? I don't feel
like writing anymore. I think I've written everything that I have to say. I enjoy teaching, so that will continue to be, an active part of my life. And, I love teaching medical students, doctors, other kinds of health professionals. I'm spending more time in my garden and cooking and with friends, and so I'm enjoying life.
That's great. As well you should, and well deserved. I will say that on a personal note, that your simple kindness, your warmth, your mentorship over the years have been really wonderful, and I feel very honored to have this conversation. So thank you again for being here and for taking the time, and I wish you very well, Dr. Andrew Weil.
Thank you.